morning, everybody. I'm Ganeshan, Vice President of MicroSynapse. MicroSynapse is engaged in manufacturing and marketing quality products for neuropsychiatric disease and therapy. Today we have assembled here on the occasion of the World Suicide Prevention Day, that falls on the 10th of September every year. Suicide today is gaining epidemic proportions. Almost 1.7 lakh people die of suicide every year, and approximately there is an increase of about 5% in the suicide deaths in the country. So, suicide is generally handled by the psychiatrist, and today we have an expert who handles these kinds of cases, and it is very appropriate to learn from him as to how he looks at the issues of suicide and the tendencies of patients, etc., who have the penchant of ending their life. So therefore, I take this opportunity to introduce at this time our panel. We have Dr. Naveen Jairam. Dr. Naveen Jairam has graduated from Devarajaras Medical College, and he did his MD in psychiatry from the prestigious NIMHANS, and he has been in the forefront of preventing suicide and psychiatry related issues and suicide. I'm sure, doctor, you would find that it's very tragic for, particularly the aftermath of suicide. First is prevention of suicide. The patient has the tendency of suicide, so you need to recognize that. And sometimes, if it does happen, you also need to counsel the people around, particularly at the dark hour post-suicide. So, doctor, how do you look at this? As a psychiatrist, how do you handle this?
First of all, thank you for inviting me for this really important topic, which is a major concern nowadays. I think suicidal risk or tendency has gone definitely high in the recent times. So when we look at the main factors contributing to this, mental illness stands first. That's where we come. As mental health professionals, the most important risk factor for suicide is mental illness. That's the first thing. In mental illness also, we give more importance and weightage to depression especially. So now there is high incidence of stress. So most of the people are going through a lot of challenges in life in terms of career, in terms of education, in terms of many issues. So major depressive disorder is the most contributing factor. So how to identify this suicidal risk is basically when we have a conversation. I think we should make it a point as mental health professional. Anybody who walks in probably, and when we understand what the situation they are going through, we make it a point that we assess for suicidal risk or ask certain questions, which is very, very important for them. We should not hesitate to do that. Comparatively, once we identify, at least we'll be able to know. Second important thing is that we already know that some people have some risk factors. For example, they have previously attempted, or they are more vulnerable, or there is any kind of family history. So then we need to identify and give importance to them that how we can prevent. Sometimes I think I would equate a suicidal risk to an emergency, like a cardiac emergency. Certain times, they need to reach like an emergency, how we treat other conditions, they need to reach a right place, right time. Probably that will definitely help. Even though the ideas might be sometimes temporary, but any kind of active intervention will definitely prevent the person from going very negative and taking that drastic step to end their life. So, of course, it's not very easy to end anybody's life, but the situation and circumstances will make them vulnerable. It's like gives them a notion that everything will end with this. Something that's like a despair and extreme emotional state, which probably certain times, and it can be an impulse, or certain times it can be somebody might be under the influence of a substance, and it might suddenly provoke them even a simple issue. So these are the challenges which we need to identify while addressing suicide among psychiatric patients.
Thank you, Doctor. Thank you, Dr. Jairam, for the wonderful insights. And as you said, digital marketing for microfinance. It's my honor to interact with you today in this World Suicide Prevention Day. My question to you is: what are the risk factors for suicide cases?
Yeah, I think that certain important risk factors for suicide is a previous attempt of suicide. Somebody has attempted previously, there's a high chance that they might attempt once again. It might be a failed attempt, or it might be a like partial attempt or something like that. Second important risk factor is family history. Family history of having suicide or mental illness. That is another risk factor. Third thing would be having mental illness, especially certain illnesses like depression, bipolar disorder, schizophrenia. That also makes them vulnerable. Also, certain times, psychosocial stresses like uh, isolation, loneliness, and lack of opportunities and other things will also make them vulnerable. Another important risk factor will be somebody who might have experienced extreme traumatic conditions in childhood, like trauma, abuse, physical abuse, or certain traumatic experiences will definitely make them more vulnerable to develop suicidal tendencies. Yeah.
Doctor, how would you help someone with suicide, or how would you identify suicidal tendencies and then prevent suicide?
This is a very relevant question. So, unless the person is willing to share, we will have no idea how to identify. But asking is very important. Sometimes we might hesitate. Oh, looks like this person might not be thinking about it. But without asking, we are not sure whether the person is thinking about it or not. So, every potential, for example, at least you have some red flags like the risk factors and all, and the person is going through this problem. Most important thing is questioning. I think we have to directly ask, have you contemplated suicide anytime these thoughts are passing in your mind? Or, sometimes they might be searching for ways to attempt. And, they'll be talking about it more. They'll be talking about some kind of nihilistic way, everything is going to end. This might happen. So, those ideologies are very, very important. So, every person should be given importance.
Once again, thank you, Doctor, so much for the wonderful insights. And my next question to you is: are there any hotlines or resources available for suicide prevention?
Yes, I think there are a lot of hotlines available. In Bangalore itself, we have many organizations like Parivartan Counseling Center, Sahai is there, and even Enhance has started Telemanus Center, which has a suicide helpline. So there are a lot of private and also governmental helplines which are available. So uh, any point of time, they will be ready to address the distress. Any point of time. I think 24-hour helplines are also there. Many people will not be aware of this. So at least the moment when they are feeling so, they express it to someone. So they can, I think the counselor or the person who talks to them will be able to definitely help them out in averting suicide. This is very important that at least, okay, there's no hope, you don't know what to do, please call up the number and try to express yourself what is happening, and they will guide the person. They will identify what might be the thing, and they will definitely help the person. How they can prevent ending up doing the right act.
So, any specific treatment or anything is there so that this can be prevented?
Yeah, as I mentioned in the beginning, mental illness is the most important risk factor. But it's not only people who have mental illness will commit suicide, because there are a lot of psychosocial factors also which might contribute. Considering economic status, family history, so many, again, loneliness, being in a city or alone, substance use. There are a lot of things which will contribute. So sometimes everybody will not have mental illness, but they will require help in terms of identifying what led to this kind of decision. So probably counseling is the main key thing in the beginning. And if we can diagnose and identify some conditions, let us say we identify they have depression, then probably we need to start treatment for that condition. Whatever condition is there, both psychological intervention and medical. Sometimes medical intervention is also warranted, because when there is a risk, one point of time we are seeing that, but successively what happens? So they might require follow-up sessions, and complete resolution will take some time. It's a process. We'll start with something, whatever we identify in between, we need to treat that, and finally, we need to help them completely come out of that state. So every effort is very much necessary. So any counselor or anybody for that matter, if they reach out to any mental health professional, definitely it's a useful thing. Thanks.
So, Doctor, I take this opportunity to thank you on behalf of Micro Labs for giving so much of insights into a very sensitive topic, which is suicide and suicide prevention. And let's hope that, as a community, we'll be able to reduce the number of suicides and the suicide burden in this country, and make our environment more livable, emotionally, particularly. That's very important. So I think you when I say you, your veteran, the psychiatrists are the beacons for mental well-being, and with your help, we are sure that suicide is something that can be prevented, and this wasteful loss of life is something that we should definitely stop. So once again, thank you, and thanks for sparing your valuable time and giving us some fruitful information on preventing suicide. Thank you, sir.
Thank you, Doctor. Thank you so much for your time. Thank you.